The name is now not that important, right? And good that you did not remember my name. And today, what is more important is what do you do exactly? What do you do as an incubator? How does a startup evaluate you as an incubator? And what an incubator means, that meaning has to be very, very clear to everyone. I represent Government Institute of Medical Sciences, which is in short called GIMS. We are a government medical college, UP's first hospital-based medical incubator located in Greater Noida. A 5-year-old medical school. The first batch of MBBS is still not out in the market. We were the best COVID care facility of government during COVID-19. We were awarded the best in terms of research and publication, innovation, and for treating highest number of COVID patients. And after that, government thought of that US and Canada, they have hospital-based incubators. So what is a hospital-based incubator? A hospital-based incubator is the right place for healthcare startups where all their demands, needs, and then the actual care which is required to enhance the quality of care. Everything comes together at the medical incubation center. We are a 630-bed medical hospital with BSL-2, with BSL-3, BSL-4 lab, negative pressure lab, genome sequencing facility, a world-class research unit, and apart from that, the first hospital-based medical incubator. Our capacity is clinical trial. Our capacity is testing of your device. Our capacity is around 40,000 plus patients every month that we see. For anything that you are designing for healthcare, you need a validation. Validation in terms of the quality, validation in terms of the efficacy, and validation whether this has no harm. That's the most important part of it. As a clinician, I practice dentistry. I'm a part of proud FMS Delhi University. Recently completed my PhD and had my first startup 10 years back, working on oral cancer screening. That brought me right here as the head of Center for Medical Innovation. As incubator, our role is very important. Well, I was talking to you. Why should one come down to our incubation center? And when we are asking for any favor in terms of equity, we should be very much justified why the startup should give us the equity. If it is 1%, 2%, 3%, why? What are we giving back to the startup? It has to be very clear. And then probably as a startup or as sitting on the other side of the table, I believe it is very, very important to initially evaluate the capacity both of the incubator as well as of the startup. Let's assume that you are a startup. Somebody sitting in the crowd wants to plan a startup and comes down to my facility. Let's assume that you come down to my facility and you meet an executive of my incubation center. He may be a qualified one, but he can only think of your vision from his perspective. You might have a vision which might be one of its kind in healthcare. You might be thinking of a potential that will change the accessibility of healthcare. But probably the first person that you are interacting at the incubation center might not understand your vision and might feel that you are not fit for this place. So that is where I strongly agree and disagree at the same point of time. As incubator, our commitment and our responsibility is very, very high to make the first interaction very, very responsible, accountable, and at my incubation center, we are also a Stanford University center. We make it sure that when we say that we will not be able to help you, it has to come with a reason. And when we say that we will be able to help you, that also comes with a reason. Do I have the sufficient capacity to help you out? So that first interaction is very, very important as incubator, so that is the right place where the startup takes off. The first taking off of the startup should not be compromised, and that's the basic role of incubator, which I believe we are justifying it with our own. Thank you. Thank you.